the world spinning around you. Suddenly, it feels like gravity has lost its grip and you're caught in a whirlwind, even though you haven't moved at all. Dr. Mike here. Today we're diving into the topic of vertigo, a sensation that can truly turn your world upside down and leave you feeling completely out of control. Imagine stepping off a fast merry-go-round and feeling like the room is still moving, even though you're standing perfectly still. That's vertigo, a powerful illusion of movement that can be both confusing and frightening. Before we move on, don't forget to hit the like button and subscribe to our channel so you'll always get more helpful tips from health and lifestyle. It's not just feeling lightheaded or faint. Vertigo is a specific, often distressing spinning or whirling sensation that can make you feel like you're losing your balance or control over your body. Vertigo can last for just a few seconds, stretch into hours, or even persist for days at a time, making even the simplest daily tasks, like walking, reading, or cooking, feel nearly impossible. Importantly, vertigo isn't a disease itself. It's a symptom, a warning sign that something's off with your body's balance system, which is responsible for keeping you steady and oriented. Our sense of balance relies on a complex system that includes the inner ears, our eyes, and sensory nerves throughout the body. These parts work together, sending signals to the brain to help us stay upright and coordinated. When any part of this intricate system is disrupted, whether by infection, injury, or another cause, vertigo can result, leaving you feeling unsteady and unsure. People often confuse dizziness with vertigo. Dizziness is a broad term that can mean feeling faint, woozy, or unsteady, but vertigo is a distinct, unmistakable spinning or rotational feeling. You might feel like you're tilting, swaying, or being pulled in one direction, even when you're lying down and not moving at all. The sensation can be so strong that it feels like the whole room is spinning around you. Simple movements like rolling over in bed or turning your head quickly can suddenly trigger vertigo, making everyday actions feel risky and unpredictable. This makes vertigo very different from the brief lightheadedness you might get from standing up too quickly, which usually passes in a moment and doesn't involve a spinning sensation. Vertigo can be overwhelming, impacting your confidence, independence, and overall quality of life. It can make you anxious about moving or even leaving your home. That's why it's crucial to pay attention to this symptom and not just brush it off as something minor. Seeking help can make a real difference. Understanding vertigo is the first step to finding the cause, getting the right treatment, and learning how to manage it, so you can get back to living your life with confidence and stability. When vertigo hits, the spinning is just the start. Nausea is common thanks to the mixed signals between your eyes and inner ear. Much like motion sickness, you might vomit or feel sick to your stomach. Abnormal eye movements called nystagmus can occur. Your eyes may dart uncontrollably. Hearing loss or ringing in the ears, tinnitus, often points to inner ear involvement. Balance problems are a major part of vertigo, making walking or standing a challenge. You may stumble, sway, or need support to move around. Even after the spinning stops, you might feel shaky or unsteady. Headaches, sweating, and anxiety can also accompany vertigo, making it a full-body experience. Recognizing these symptoms helps your doctor pinpoint the cause. So, why does vertigo happen? If you've ever felt the world spinning around you, you know how unsettling it can be. But what's really going on inside your body to cause this strange sensation? Most causes of vertigo trace back to issues in the inner ear or the brain, which are both crucial for maintaining your sense of balance and orientation. The most common culprit is something called benign paroxysmal positional vertigo, or BPPV. This condition is responsible for a large number of vertigo cases, especially in adults. In BPPV, tiny calcium crystals, called otoconia, inside your inner ear become dislodged from their usual spot. When these crystals move into the semicircular canals, they disrupt the normal flow of fluid, sending confusing signals to your brain and making you feel like you're spinning, even when you're perfectly still. Inflammation in the inner ear, such as vestibular neuritis or labyrinthitis, can also trigger severe vertigo. These conditions often develop after a viral infection, causing sudden and intense dizziness that can last for days. Another cause is Meniere's disease, which, although less common, involves a buildup of fluid in the inner ear. This leads to unpredictable vertigo attacks, hearing loss, and a persistent ringing or buzzing sound known as tinnitus. Vertigo can also be a side effect of certain medications or result from head and neck injuries. In rare cases, more serious issues like a stroke, brain tumor, or multiple sclerosis can be the underlying cause, making it important not to ignore persistent symptoms. Sometimes, The reason is surprisingly simple: a nutritional deficiency. Lacking key vitamins and minerals, especially those that support nerve and brain health, can disrupt your body's balance system. The good news is that many causes of vertigo are treatable or even reversible, especially when caught early. That's why understanding the root cause is so important. Pinpointing what's behind your vertigo is the first step toward finding the right treatment and getting your life back to normal. If you're experiencing vertigo, don't brush it off or try to tough it out. Make an appointment with your doctor to get checked out and discuss your symptoms in detail. Your healthcare provider can help determine whether your vertigo is caused by something minor, like a vitamin deficiency, or if it's a sign of a more serious underlying problem that needs immediate attention. Next, let's take a closer look at how vitamin deficiencies, especially a lack of vitamin B12, can play a surprising role in causing vertigo and what you can do about it. Sometimes, the answer to your dizziness is hiding right in your diet. Let's dive in and explore how nutrition can make all the difference. A lack of essential vitamins can cause vertigo and dizziness, but it's often overlooked. Your nervous system relies on nutrients to keep your balance system working smoothly. Low vitamin D may affect the tiny calcium crystals in your inner ear, making vertigo more likely. B vitamins, especially B12, are crucial for nerve health. Deficiencies can lead to dizziness and unsteadiness. Of all the vitamins, B12 deficiency is most strongly linked to neurological symptoms like vertigo, and it's treatable. Vitamin B12 is absolutely vital for your nervous system, playing a crucial role in keeping you balanced and steady. One of its most important jobs is maintaining the myelin sheath, the protective fatty layer that wraps around your nerves like insulation on electrical wires. This sheath helps nerve signals travel quickly and efficiently throughout your body, ensuring your brain and muscles communicate smoothly. Without enough B12, this insulation starts to break down. When the myelin sheath is damaged, nerve signals can slow down, become scrambled, or even stop altogether. This disruption can have a dramatic impact on how your body functions, especially when it comes to balance and coordination. As a result, the nerves responsible for balance and spatial awareness may not work properly, leading to symptoms like dizziness, vertigo, and a general feeling of being off balance. Even simple movements can suddenly feel challenging or unsafe. In severe cases, a lack of B12 can cause a condition called subacute combined degeneration of the spinal cord. This can result in a significant loss of balance, an unsteady walk, and difficulty coordinating your movements. Everyday activities like walking or standing up can become much harder. Early symptoms of B12 deficiency are often subtle and easy to overlook. You might notice clumsiness, tingling, or numbness in your hands and feet. Sometimes you may feel a slight loss of sensation or a pins and needles feeling that comes and goes. These signs are sometimes mistaken for normal aging or dismissed as minor annoyances, but in reality they could be early warnings that your body isn't getting enough B12 and that your nerves are starting to suffer. Recognizing the connection between B12 and your sense of balance is key. Early detection and treatment can prevent permanent nerve damage and help you regain your confidence and stability. If you're feeling unsteady, dizzy, or experiencing unexplained numbness, don't ignore these symptoms. It's important to talk to your doctor and get checked for B12 deficiency. B12 deficiency is surprisingly common, especially among older adults, vegetarians, vegans, and people with certain medical conditions. The good news is, it's also one of the easiest deficiencies to treat with supplements or dietary changes. In the next section, let's talk about how you can make sure you're getting enough B12 to keep your nerves healthy and your balance strong. So, how do you make sure you're getting enough B12? It's found almost exclusively in animal products. Meat, fish, dairy, and eggs are top sources. If you eat these foods regularly, you're likely covered. But vegetarians, vegans, older adults, and people with digestive issues or on certain medications are at higher risk for deficiency. Fortified foods like cereals and plant-based milks are good options for those avoiding animal products. Always check nutrition labels for B12 content. If you're at risk or already deficient, supplements are safe and effective, available as pills, sublingual tablets, or even injections. Your doctor can help you choose the best form and dosage. Don't wait for symptoms to get worse. Be proactive about your B12 intake. Prevention is easier than treatment. Next, let's look at lifestyle tips to support your balance. Beyond B12, simple habits can help manage dizziness and improve balance. Stay hydrated. Dehydration is a common cause of dizziness. Manage stress with relaxation techniques like deep breathing or meditation. Prioritize quality sleep to keep your brain sharp and steady. Gentle movement and balance exercises like standing on one foot or focusing your gaze while moving your head can retrain your balance system. Make your home safer. Use night lights, remove tripping hazards, and install grab bars if needed. Wear sturdy shoes for stability. These small changes can make a big difference in your daily confidence and safety. Consistency is key. Practice these habits regularly. Let's talk about when to seek medical help. Sometimes, vertigo signals a medical emergency. If you have sudden, severe headache, double vision, weakness or numbness on one side, trouble speaking, or difficulty walking, seek help immediately. These could be signs of a stroke, even without red flags. If your vertigo is new, severe, or persistent, see your doctor. They'll ask about your symptoms, check your hearing and eye movements, and may order tests for B12 deficiency or other causes. Don't self-diagnose, get a professional evaluation. Early diagnosis can prevent complications. Your health is worth it. Let's put it all together. Vertigo is a symptom, not a disease, and can be caused by inner ear issues, infections, or vitamin deficiencies, especially B12. Pay attention to your diet and risk factors. Are you vegan, over 60, or have digestive issues? Talk to your doctor if you're at risk. Include B12-rich foods or fortified options, and consider supplements if needed. Support your balance with hydration, sleep, stress management, and safe movement. Make your environment fall-proof. We hope you've enjoyed this video and found it informative. Don't forget to give us a thumbs up and subscribe to Health and Lifestyle for more helpful tips. Don't let vertigo control your life. Take proactive steps for a steadier, healthier you. Stay informed, stay safe. Thanks for watching. Stay healthy and stay curious.